Hello, I'm Kevin, and it's great to be here at the Arab Health Conference where we have the opportunity to meet with some of our key opinion leaders in the region. I'm actually joined today with Dr. Sanji, who's the VP of Healthcare IT at Malaffi, Healthcare Informatics Exchange, one of our key partners, and it's great to have the opportunity to share some dialogue with you today. Welcome.
Well, it's a pleasure to be here. Thank you for hosting me.
Oh, great. So let's understand maybe from the perspective of Malaffi, what was the intention of being able to create a healthcare information exchange in this region?
Yeah, that's a great question. I mean, Malaffi was set up as a health information exchange platform, the first in the region, as part of the strategic initiative of the Department of Health to transform the way they were delivering healthcare in the Emirate of Abu Dhabi. So really to look at how to improve efficiencies across the care continuum, to look at improving patient outcomes, and also ultimately, I guess part of it was to try and reduce the cost, or at least contain the rising cost of delivering healthcare in the region. So we were set up because of what's commonly known as information silos. So healthcare facilities tend to retain data in their own facilities, in their own EMRs, without sharing it. So Malaffi was really pulled together as a centralized platform for exchanging data and also storing centralized data, and therefore a patient now, regardless of which facility they go to, their treating clinician can now have access to information not just from within their own electronic medical record, but what's been captured and happening to that patient across other facilities that they may have visited. So really trying to break down these barriers of lack of communication, improving the efficiency in which care is being delivered to our patients. So that was the fundamental premise.
And helping to really harmonize that care so that we can really deliver incredible care for those patients when they're coming through.
Absolutely, yeah, exactly. I mean, there's a lot of frustration amongst not just patients who felt that they were repeating patient histories, they're having to repeat, answer questions that have already been asked of them, and for the providers as well. They felt that they were not able to deliver the best quality of care because they didn't have access to all the information that they needed at the point of care.
Yeah. So maybe tell us a little bit about some of the challenges. I mean, integrating this amount of data has got to be a very tall order and making sure that all works properly. Tell us a little bit about some of the challenges you faced and how Philips was able to help you surmount those challenges in the implementation.
Yeah, absolutely. I mean, and to touch on what we're doing at Philips, so we've integrated many data domains, and part of that was the radiology reports. And from a very early stage, our clinical community basically said, look, having the radiology reports is great, but actually we want to have access to the images behind those reports. So this is where we started to identify, how we could do this. We're one of the first health information exchanges in the world to actually implement HIE-wide image exchange platform, and we're very proud and pleased to have Philips as our partner in supporting us. So now what we're trying to do is to allow our clinical community to our clinicians, when they're seeing a patient, they can read the report and seamlessly access the image as well. And what we're hoping this is going to do is actually reduce the number of duplicate investigations that are done. I mean, radiology images, as you know, diagnostic images are very expensive. And trying to, contain the cost of that, but also from a patient perspective, improve their patient journey. So as a patient, I don't need to now go and have a repeat CT, MRI, or an X-ray, because my physician now in another facility, if I'm referred to them, for example, can have access to that image. So I get access to healthcare quicker. I'm not waiting for a repeat test. I'm not being exposed to unnecessary radiation. And I don't have to come back and see the clinician again in maybe a week or 2 weeks' time. Yeah. So we're really hoping that the image exchange platform is going to improve efficiencies, it's going to contain costs, and ultimately, lead to a better patient experience.
No, the great thing is that we're actually using technology not only to improve the physician experience, but take into account the patient experience along the way, and that has huge implications.
Absolutely. I mean, this is one of the things that we've always had fed back to us from our clinicians is having access to this information is not just going to help them, it's also going to help our patients. It's going to help the patient engagement and relationship between the physician and the patient. So this is going to impact the whole healthcare market in Abu Dhabi in multiple ways.
Tell us a little bit about what the clinicians are saying themselves in terms of the usability of the system. Mm-hmm. How has it improved their experience, not just the care, but their experience in using it?
Absolutely. I mean, one of the key premises when we actually implemented Malaffi was to make sure that we had seamless access for our clinicians. So they don't have to log in, they don't have to search for a patient. Directly from their electronic medical record, they can have one click on the Malaffi icon, and it launches the patient's Malaffi record in context of their electronic medical record. And we've now extended that to access the Philips ViewMotion solution as well. So they click on they read the radiology report, there's an icon there, they can seamlessly launch the image and have access to the Philips image viewer with all the capabilities of comparing images from across facilities, being able to utilize the different tools that you would expect with any PACS image viewer. So the feedback we've got so far is very promising. We're in the earlier stages of our rollout. By the end of 2023, we hope to connect to over 60 facilities and their PACS image viewers to then provide our clinicians with access to around about 2 million diagnostic images a year. Wow. So something quite, obviously it's challenging at times, but I think the overall provider community have been very supportive. This has been clinically led and clinically driven by our clinical advisory committee and feedback we've got from other physicians and clinicians. So the adoption we're hoping is going to be equally good and positive.
And quite revolutionary, I might add, as well.
Well, yeah, I mean, we're one of the few, I think a handful of health information exchanges that have actually invested in delivering a image exchange solution across a whole region.
So let me ask one last question, if I could,
Sure.
And that's let's think a little bit about into the future. Where do you see the Health Information Exchange initiative going? As you mentioned, we're only in the initial stages. Where do we see this going in the upcoming years?
Look, I think the potential is huge. If you look at artificial intelligence, for example, I think that's going to play a huge part in healthcare and how healthcare is delivered. We have an aging population and a growing demand for healthcare services, and trying to automate certain aspects of healthcare delivery is going to be key. And with regards to the image exchange, now we're able to combine imaging information as well as clinical information like clinical biomarkers, lab results, patients, genomic information in the future. And it's really going to support, at least initially, things like screening programs, screening for breast cancer, screening for other lung issues, lung diseases, where you can now, AI can not only be utilized to identify an abnormality on an image, but also incorporate other clinical data that may actually change the interpretation of that potential abnormality from maybe a benign mass to something that maybe needs to be looked at a bit more seriously.
Right.
So the potential to start utilizing imaging information along AI and machine learning algorithms to deliver more personalized care, I think is something that's very exciting and what we see coming up next for us.
Right. So it's not only the intention of being able to improve access, but intelligence along the way. So Dr. Sanji, I wanted to thank you very, very much for your partnership, for your time. We really we're very excited by this partnership and the opportunities that this might present for the broader clinical community. And we welcome all of our partners to come visit us at the booth at Arab Health and experience what we have to offer in the overall healthcare informatics domain. Thank you.
Thank you.